Hi, everybody, and welcome to what I think might be the last lecture for Chapter 19. We'll see. We're going to talk about different groups that monitor monitor your epidemiology, monitor different diseases, and then we're going to talk about some emerging infectious diseases and some problems there. So the first place we'll talk about is the Centers for Disease Control. So the CDC is a group that provides support for labs in the U.S. and in other countries. And what these labs do is they collect data on diseases that will impact the health of individuals. They publish information about these different diseases and conduct research on these infectious diseases. And so here's a list of the diseases that the CDC gets notified about. And so there's a lot of stuff on here. I'm not going to go through all of them, but there's multiple diseases that if they see these diseases, they are contacting the CDC to let them know that they have a case of this disease in their state. Public health departments in each state then can mandate that diseases be reported, that different diseases be reported. Washington State health authorities responded to an E. coli 0157H7 outbreak. So that's your pathogen that causes severe diarrhea in 1993, and Cryptococcus gattii in 2007. And so what that does is it stops the spread of these diseases, which is really good. Public health departments do other things as well. So they also follow school absentees. This can be impacted by different diseases. Hospital laboratories report the isolation of pathogens that could be potentially important or significant to the field of epidemiology. And news media then alert public to the presence of these infectious diseases. The World Health Organization has 4 major functions. So it provides guidance in the area of health. They set global standards for health. They strengthen national health programs, and they develop and transfer appropriate health technology. So they provide education and assistance to all their members, so 193 different member states. And they distribute information about epidemics, I don't know why I couldn't say that, that are potentially going to cause global pandemics. And so all of this has led to the reduction and eradication of different diseases, and that's what we're looking for. Many diseases have been reduced because we are following them. Epidemiologists are following them, and they're able to figure out how to decrease the spread of a disease. So things like improved sanitation, control of the reservoir or vectors, vaccination, and of course antibiotics. In the U.S., there are a lot of diseases that used to be very common and they're now rare, or they have been eradicated. The example for the eradication is smallpox. Smallpox has been eradicated globally. So at this time, they are working to eradicate measles, polio, and dracunculiasis. So I just want to mention that I don't think measles will ever be eradicated unless the individuals who consider themselves anti-vaxxers open up their mind and realize that measles is much more dangerous than the vaccine. I'm and science backs this. Science backs the vaccination process. Doctors back the vaccination process. So a person who has no knowledge of science, a person who has no understanding of the scientific method or understanding of the human body, cannot or should not stand in the way of science. That's just my opinion. But again, I can spread my opinion a little bit. And if you don't agree with me, well, then you just don't agree with me. That's fine. But hopefully we'll get the measles eradicated as well. There are some emerging diseases. So emerging diseases are diseases that have either been novel or so they weren't anything, like there was maybe one case in multiple years, or they're starting to increase in numbers a lot. So a disease that you haven't seen in a long time and now it's all of a sudden coming back. So things like Middle Eastern Respiratory Syndrome, MERS, Ebola virus disease, Zika virus disease. These are all newly recognized diseases, so they're re-emerging. Diseases that we have seen an increase in incidence is are malaria and tuberculosis. And there are a lot of different reasons that we're seeing these increasing numbers. So one reason is microbial evolution. So microbes evolve. They're going to evolve mechanisms to protect themselves from a host immune system. They're going to evolve mechanisms to protect themselves from any potential chemicals that are going to try to kill them. Complacency. So the public feels comfortable because they haven't seen this disease in the environment, and so they stop worrying about the disease. An example is tuberculosis. I'm going to use the example of measles, though. How many people have seen a child suffer from measles? Not very many. And because of that, measles seems like the lesser of two evils. Measles, the disease, is not as dangerous as the vaccine, which they see all the time, which is not true. But there's another example. So changes in society. So the fact that we have households where both mom and dad work means that we have to use daycare centers. And daycare centers allow small children to come in contact with each other a lot more often. And so that's going to spread diseases faster. We have advances in technology, which actually can cause disease spread. So the fact that we now have contact lenses, and contact lenses are going to be able to spread certain diseases from or to your eyes, especially those lenses that you wear for multiple days in a row. Population expansion. So we're coming in contact with more reservoirs of infection because we're spreading out more. We have a bigger population, so we're moving into areas that used to be wooded. Development. So producing dams causes an increase in snails. An increase in snails increases the number of schistosoma worms, and which then increases schistosomiasis. So mass production of food increases the likelihood that foodborne illness is going to occur. War and civil unrest, so disruption of infrastructure or eradication efforts, can lead to poor environmental conditions for people to live in. So we already know that developed countries are less likely to have certain types of diseases than developing countries. But civil unrest, war can actually lead to those types of conditions again. And then climate change. So warm temperatures increase the number of vectors that are spreading diseases. The increased vectors and the increased temperatures can allow vectors to move farther and farther away. And so this can increase the not just the period of time that we have certain vectors out, but also the area that these vectors can spread disease. So diseases are going to move further as well. It's 10 minutes. You know what? I'm going to finish up. I hope this is only going to be about 5 minutes, but the last thing we're going to talk about are healthcare associated infections. And you know what? I'll stop here and I'll go to the next video. So we'll probably have hopefully a 5-minute video for our last one. So I will stop now and I'll get into HAIs in our next video. Bye.